Hello, welcome to this YouTube video. My name is Hannah and I'm a UK registered nurse, a university lecturer, and I've been an NMC OSCE programme lead, and I also provide one-to-one private OSCE tutoring and support. So my other video where I read through the hospital prescription chart, so how to read the hospital prescription chart correctly and pass, is a really popular video on YouTube. So I thought I'd do a similar video looking at the community medication prescription chart as well. So implementation station can cause a lot of worries for nurses because they're not entirely familiar with the charts, what they need to read out, what they don't need to read out. So I just thought I would go through this video. I'm going to bring up a prescription chart. I'm just going to verbalise exactly through what we need to do in that station and share the chart with you as well. Okay, so obviously just remember with your community implementation station, just some key differences that we just need to remind ourselves of. So firstly, there's going to be no hospital wristband or hospital allergy band. So we just need to verbally confirm with the patient their name, date of birth and address, or GP surgery if there's no address, and verbally confirm their allergies and check that against the prescription chart, but there'll be no wristbands. All are the same principles apply. Remember, in the community, we have those community-specific directions as how medications are prescribed in the community. And they still need to have all those legal requirements. So we still need to have the date, the name of the drug, the dose, the route, the frequency. We do have to have an end date. That is a legal requirement of community-specific directions. So we need to make sure the end date is present. We need to confirm the prescriber's signature and name. There won't be a bleep. There might be a telephone number, but they should always have a date as well. So it'd be signature, name and date in the prescriber's box, and confirming that prescription is valid. So I've got the chart up here. I'm just using my homelessness chart. So this is just one of my scenarios. And we're going to go through and verbalise this station and look at the chart. So we've been asked to visit Johnny Tyler. So he's been transferred to the community outreach nursing team, and we're working out of the Station Road GP surgery. We've been asked to visit him and administer the 12 o'clock medications in a safe and professional manner. Okay, so we're looking for medications at 12 o'clock. The date is today and we've got 15 minutes. Okay, so I'm going to ensure privacy and dignity. Going to decontaminate my hands using the World Health Organization 7 steps. So palm to palm, palm on back of hands, fingers interlaced, palm to palm, fingers interlaced, fingers interlocked, thumbs, fingertips, and wrists. And I'm going to introduce myself to the patient. So hello, Johnny, my name's Hannah. I'm the nurse looking after you today out of the community outreach team. And I've been come here to administer your 12 o'clock medications. But before I proceed, I just want to check your full details. So can you tell me your name and date of birth, please? Okay, thank you. So I can see that I've got Johnny Tyler with a date of birth of the 25th of the 8th, 1954. And can you just confirm, so I see there's no address here, fixed address here, but so can you just confirm your GP surgery for me? Okay, great. So we've got Dr. Giles, Station Road GP surgery. Thank you, Johnny. And can you just confirm if you've got any allergies? Okay, so you're allergic to elastoplast, and what reaction do you get to that? Okay, rash and itching. Okay, I can see that's documented here on my medication chart, so I'm not going to give you or administer anything when you're dressing with elastoplast in. So like I said, Johnny, I've come to give your 12 o'clock medication. Do you consent for me to go ahead and get that ready? Okay, thank you. And I'll explain each medication once I've got those out and before I give those to you. But before I just prepare your medication, can you just tell me if you've got any pain? Okay, so you have got some pain. So on a scale of 0 to 10, 0 being no pain and 10 being the worst pain you've ever experienced, what pain would you rate that as? Okay, a 4. Okay, so I'm going to check and see when you last had some analgesic and whether we can give you any further analgesic. And if not, I'm going to escalate this to your GP. Okay, and do you feel sick or nauseous at all? No, okay, that's great. So what I'm going to do, John, is I'm going to read through and confirm your prescription, then we're going to get your medications and come back and explain them to you. So remember, we need to read the whole first page of the job chart. I've got surname is Tyler, full name is Johnny, date of birth 25th the 8th, 1954. There's no fixed address, but I've got GP surgery of Dr. Giles, Station Road GP surgery, a height of 1.8 metres and a weight of 75 metres. So I've got my prescriber's details here. So I've got J. Johns with a GMC number of 15674, signature of J. John, and a telephone number here, 45679. So I confirm I've got my prescriber's details. I've already checked my allergies and the patient's allergic to elastoplast with rash and itching, and this has been signed by the Dr. J. John, and the date is today. There are medication risk factors here. So we've got medication risk factors of diabetes. And I'm going to go on and read my second page. So I've got Johnny Tyler, date of birth 25th the 8th, 1954. No address, but with a GP surgery of Dr. Giles, Station Road GP surgery. So I can confirm I've got the right patient. So just codes there, no medications prescribed. Okay, so I'm on to my community patient-specific directions. So again, confirming that first right of the patient each time. So I've got Johnny Tyler, 25th of the 8th, 1954, with their GP surgery, Dr. Giles, Station Road GP surgery. So I'm looking here for my medications at 12 o'clock. So I've got flucloxacillin here, but it's 6 o'clock in the morning and it's already been given. So I'm not going to administer this medication. Moving on to my next prescription here. Okay, so this is due at our time. So I've got the date is today, the drug is flucloxacillin, the dose is 500 milligrams, the route is oral, the time is 12 o'clock, the frequency is QDS, end date is 7 days. I've got a prescriber's name of Johns and a signature of J. Johns and a date of today. So I can confirm this prescription is clear, valid and legible. It's due at my time. I'm going to administer this. I've then got 2 further prescriptions for flucloxacillin, one due at 6 and one due at 10 o'clock. So these are not due at my time, examiner, so I'm not going to administer those and I'm going to move on. So I'm on to my next page. I've got Johnny Tyler, date of birth 25th the 8th, 1954. I've got a GP surgery, Dr. Giles, Station Road GP surgery. So my Mets medication here. Okay, it's 12 o'clock, so it's due at my time. So I've got the date is today. The drug is chlorphenamine malate. The dose is 4 milligrams. The route is oral, the frequency is once a day, the end date is 7 days, and I've got prescriber's name of J. Johns and a signature of J. Johns and the date of today. So I can confirm this prescription is clear, valid and legible. It's due at my time. I'm going to administer it. So I've got another medication here, so aspirin. Okay, this was due at 8 o'clock and it's already been administered, so I'm not going to administer this. And I've also got ramipril, again, due at 8 o'clock. And has already been administered, so I'm not going to administer this medication. Remember, those medications that are not due at your time have already been administered. We don't need to read the full prescription out, okay, but we do need to verbalise to the examiner why we're not giving them. Okay, so now I'm on to paracetamol. I can see the patient has had a dose of paracetamol at 8 o'clock. Here, okay, so I've got another prescription here of paracetamol. So my patient is in pain with a pain score of 4. It's 12 o'clock now, so they last had a dose at 8. So I can give another dose now at 12 o'clock, so 4 hours have passed. And it doesn't look like they've had more than 4 doses in 24 hours. So I'm going to read this prescription out. So I've got the date is today, the drug is paracetamol, the dose is 1 gram, the route is oral, frequency is PRN, so as required, but the frequency is 4 to 6 hourly. End date is ongoing. I've got prescriber's name, J. Johns, and signature, J. Johns, and the date of today. So I can confirm this prescription is clear, valid, and legible. I'm going to give this paracetamol because the patient is still in pain, and it's been 4 hours since the last dose, and I can't see that they've had any other doses of paracetamol. Moving on to my last page, again, got Johnny Tyler, date of birth 25th the 8th, 1954, same GP surgery, Dr. Giles, Station Road GP surgery. There's no other medications prescribed and there's no admitted medications. Okay, so I'm going to go to my medication box as we're in the community. Going to decontaminate my hands using World Health Organization 7 steps, palm to palm, palm of bucket hand, fingers interlaced, palm to palm, fingers interlaced, fingers interlocked, thumbs, fingertips, and wrists. I'm going to get out my first medication. So I've got here flucloxacillin. The dose is 250 milligrams and the expiry date is 04/29. And I've got prescribed flucloxacillin. The dose is 500 milligrams. So I need 2 tablets of my stock dose to get to my prescribed dose. And I'm going to dispense those into my tab box using a non-touch technique. So 2 tablets. 2. And I'm going to move on to my next medication. So I know flucloxacillin is an antibiotic, and I know my patient has got a wound infection, so this is appropriate to give, and they're not allergic to penicillin, so it's safe to give. Next medication is chlorphenamine malate. So I've got chlorphenamine malate, It is 2 milligram tablets and expires 04/27. And I've got prescribed chlorphenamine malate 4 milligram tablets. So I need 2 tablets. Again, I'm going to get a separate pot and I'm going to put in 2 tablets too. So this I know is an antihistamine. It can be used if the wound is very itchy. It can cause sleepiness and drowsiness, but I'm happy to give that to the patient. Aspirin or Amypyl have already been given, and then I'm going to give my paracetamol. So I've got paracetamol 500 milligrams, expires 02/28, and I've got prescribed paracetamol 1 gram. So I need to get 2 tablets to get the correct dose. I'm going to put 2 tablets into my pot. And that's all 3 medications ready to go. So I'm going to get back to the patient, decontaminate my hands. And again, I'm going to do my second ID check. So Johnny, I'm back with your medications now. Can you just confirm your name and date of birth for me? Okay, thank you. So it's Johnny Tyler, date of birth 25/8, 1954. And I've got no address, but just your GP surgery again. Okay, Dr. Giles, Station Road GP surgery. So I confirm I'm back with the right patient. So John, I've got 3 medications for you. The first one is flucloxacillin. This is an antibiotic to help with the wound infection in your leg. It can make you have a little bit of an upset stomach and some diarrhea, but are you happy to take this one? Okay, thank you. Do you want some water? Perfect. Okay. Your next medication is chlorphenamine malate. This is an antihistamine, so it will help reduce the itchiness around your wound, which you're experiencing at the moment. It can make you a little bit sleepy and drowsy, so just be aware of that. But are you happy to take this medication? Okay, thank you. And the last medication is paracetamol. I'm sure you've had this before, so common pain reliever medication. It's important you don't take more than 4 doses in 24 hours, otherwise it can cause liver problems and liver damage. Are you happy to take this medication? Okay, great, thank you. So that's all 3 medications administered now. Johnny, what I'm just going to do is do my documentation. So I'm just going to decontaminate my hands and I'm just going to document my medications here. So remember, with your community specific directions, you must put your signature, your date, which will be your test date. I'm just going to write today, but you'll write your test date in, and the time that you've given that medication. So the time goes into every box. So I'm just signing for my paracetamol here. I'm going to go and sign for my chlorphenamine malate. Again, signature, date and time, 1200. And I'm going to sign for the flucloxacillin. Be careful signing for these type of medications because you'll have 4 prescription boxes all with the same name, and it'd be quite common to accidentally sign in the wrong box. So we just want to make sure we're not doing that. Again, signature, date and time. I'm signing in the 12 o'clock box, and then I just need to go onto the front page, and similar to the hospital chart, so I'm going to put my name, full name in, my initials, my signature, so how I've signed for my medications, and your base will be where you're working as the community nurse. So in our scenario, we're working from Station Road GP surgery. You might be working out of a named community clinic. So always the base of where you're working and not where the patient is or the patient's home. So I've completed all my documentation now. I'm just going to check in with the patient. So Johnny, I've given all your medications now. Because we're in the community, I'm just going to stay around for 30 minutes just to make sure there's no adverse reactions. And after this time, if you experience any side effects or you're worried at all, need any advice, you can call your GP surgery or NHS 111. Do you have any questions or anything before I go? No? Okay, thank you very much. And that's the end of my station. And I'll just finish that with my final hand hygiene. So the community charts are quite straightforward. Like I've said before, there's no oxygen, there's no separate once onlys, there's no PRN. So they watch out for these paracetamols, which are prescribed as a PRN in that community specific direction. Your read through is exactly the same, dispensing is the same, and you still need to know a good overview of your medication knowledge. Make sure you remember to sign, date and time each of those medications that you have given in the community specific directions. So the common community specific direction charts are the homelessness scenario, the Alzheimer's scenario and the community assessment scenario. So those are good ones obviously to practice with community specific direction charts as well. Again, make sure you spend equal time with these charts as well as your hospital charts when you're preparing for your OSCE, because you can get any scenario in your exam.